first lobotomy was performed by a Portuguese neurologist, Egas Moniz. Egas first used the surgical procedure in 1935, when it was originally called prefrontal leukotomy. Egas Moniz believed that severe abnormal behavior and thinking was caused by nerve pathways that carried the thoughts. So to cure the disease, he sought to cut the connection, and that would restore normal mental functioning. A year later, Egas published a study detailing how successful his procedure was. The paper caught the eye of an American neurologist, Walter Freeman. Walter became a large supporter of the procedure and essentially paved the way for lobotomies to become a large part of American psychiatry during the 1940s and 50s.
Like mentioned earlier, the lobotomy started in the 1930s, and this was because doctors thought they could cut nerve tracks to the frontal lobe and can help patients overcome psychiatric problems. The doctors did this purposefully, like damaging the brain, just so they can help cure mental illness. The first procedure involved cutting a hole in the skull and injecting ethanol into the brain to destroy the fibers or nerves that connected the frontal lobe to other parts of the brain. Later, Moniz introduced a leukotomy, which contains a loop of wire that, when rotated, creates a circular lesion in the brain. The Italian psychiatrist Amaro Fimbiardi first developed a procedure that involved accessing the frontal lobes through the eye sockets, a method that would not require a traditional surgeon and operating room. The technique involved using an instrument called an orbitoclast, a modified ice pick, which the physician would insert through the patient's eye socket using a hammer. They would then move the instrument side to side, separating the frontal lobes to the thalamus, the part of the brain that receives and relays sensory input. The next couple of photos will show some before and after shots of lobotomies. The reason why people got this surgery done was to reduce the symptoms of mental disorders, and they did this by getting rid of their personality and their intellect. After their operation, responsiveness, self-awareness, and self-control was reduced. Some people gained weight and had enormous appetites and also had recurring seizures. Some other effects that patients had after this surgery included increased temperatures, vomiting, diarrhea, and ocular infections. They also experienced risk of infection, bleeding, suffering from depression, schizophrenia, panic disorder, mania, and other mental disorders. Patients also experienced a wide variety of psychological effects, such as timing and local disorientation. To continue, some other negative side effects that some patients experienced included disabling impairments, brain damage, and even death. But not all patients suffered. For the ones that didn't experience terrible side effects, they were able to leave the hospital and continue to work on their everyday lives.
There are two main types of lobotomy, the prefrontal lobotomy and a transorbital lobotomy. A prefrontal lobotomy is where the doctor drills holes in the patient's skull to access the brain and must be done under general anesthesia. In a transorbital lobotomy, also nicknamed the ice pick lobotomy because the tool used resembled an ice pick, the doctor uses a tool inserted under the eyelid to scrape away the connections to the prefrontal cortex. The transorbital procedure, brought to America by Dr. James Watts and Dr. Walter Freeman, made lobotomies available to many more people. For state mental hospitals, who had the largest number of mentally ill patients at the time, doing a frontal lobotomy simply wasn't economically feasible. They needed a trained surgeon, an operating room, and general anesthesia, all of which cost lots of money. In addition, the old prefrontal method had a lengthy surgery and long recovery period. The new transorbital lobotomy could be performed by almost any doctor in under 10 minutes with local anesthesia, and the patient could return home within days of the procedure. The transorbital lobotomy also had fewer and less severe side effects and was equally as, if not more, effective than the prefrontal lobotomy.
After the lobotomy craze had ended, a few notable cases arose, mostly due to the fact of who the patients were. Eva Perón was an Argentinian film actress and the wife of the Argentinian president from 1945 to 1952. She was originally diagnosed with cancer before receiving the lobotomy. When the pain caused by the cancer became too much, Eva got a lobotomy to help control the pain, along with a little personality modification. Howard Dooley is the author of an autobiography, My Lobotomy. Howard was given a lobotomy after a hasty diagnosis of childhood schizophrenia when he was only 12 years old. He led a problematic life after the operation, but eventually started to lead a stable life. Elise Robbie was a famous Canadian singer before a car crash sent her into a downward spiral. She only received a concussion, but the stresses of life made her have a nervous breakdown. She was given a lobotomy and remained as a patient in the psychiatric hospital for 6 years before her eventual release. Afterwards, the stigma of her illness kept her from going back to stardom. Rosemary Kennedy, the older sister of former President John F. Kennedy, was another lobotomy patient. Rosemary had some mild learning deficits and some moodiness, and that was all that was needed for the doctors to suggest a lobotomy. After the lobotomy, Rosemary was left practically disabled, having minimal function in all of her limbs and only being able to speak a handful of words. Phineas P. Gage can be considered a case of an accidental lobotomy. An accident drove a spike through his head, destroying parts of his frontal lobe. Phineas survived the accident, but had a drastic shift in personality afterwards.
Do we still do lobotomies today? The answer is no. There are two main reasons why the lobotomy fell out of favor in the mid-1950s. The first of which is that Freeman performed lots of lobotomies without using properly sterilized tools, which led to more complications than would be expected. The second reason is that in 1955, the first antipsychotic drug, chlorpromazine, came to America, with more following after. Because of their less severe side effects and more controlled nature, psychopharmacology soon became the preferred treatment method for mental illnesses. Today, there are many drugs that doctors can prescribe patients that can treat them more effectively and with less side effects than a lobotomy. Although lobotomies are no longer performed, there are other psychosurgeries that are used in extreme cases of epilepsy that have been resistant to medication.